Hello guys, I hope everything is great. Today I want to show you this incredible case review of this class 3 case that we have some sequential distalization in the lower posterior teeth so we can achieve a better class and a better overjet. So I want to show you what we have so far. Over here I have in the left side you will see the initial design, the initial position, the way we plan the case, and the cutouts that we use, because we recommend to the doctor, as you can see in this right image. This is going to be a very long review, but I hope you guys enjoy it because it's very, very nice. I will remove the let me just remove the previous scans and let me just give you the position that we have right now. I recommend that the doctor to place a mini screw. He places it in the buccal shelf, and then as you can see here, we place some cutouts. According every tooth that was starting to distalize, we place a cutout as soon as the tooth started the distalization process. And of course, the mini screw was placed over here, which I think it did pretty good results. Have a look how we're doing. This is the scan on step 30. We are going on step 30, so we should have some sort of these results. And if we compare, we already have the space closure here. Everything it's doing very, very nice. If we compare with the design scans, we should have space between the canines and the premolar. We should have space between the canine and the incisor, which we're having a bit of delay over here in this canine. As you can see, I will show you in the superimposition right now. And in the other side, the same concepts, mini screw, chains to make the distalization. I think the right side is going way much better. We can see the short space that we have here, very light short space over here. We have a short delay, and obviously we have a little bit more of, also a little bit of delay over here, but we are doing very, very, very good. And this is the situation so far. I want to show you what we plan. We plan sequential distalization. I think we always respect the 50% protocol, sequence protocol. If I'm not using mini screw, I would have done this sequence 100% each tooth at a time. But because we are doing with mini screws, I did it 50% and it's working. The results for me are amazing. Distalizing in the lower arch, the posterior segment, is very complicated. It's very hard to do it without mini screws. And this is what we have so far. So it's tracking very nice. We have some delays, and I will show you right now. This is how it's supposed to be. Design on step 30. So if we check the superimposition, let me make this a little bit bigger so we can have better view. Now the green one is how it's supposed to be. You can see that the distalization was achieved very, very nice in the posterior segment. We have short delays maybe in the lingualization. Probably we achieve as much lingualization as we can as well here. But the distalization, it's doing very, very nice. Delay in the canine. Why? Probably because we don't have the force of the mini screw. And I think this is something very important, that always use mini screws to distalize in the lower arch. Okay, now very, very nice results. Now let's compare the upper arch. The upper arch is a little bit easier to do, but if we compare, we have 3 scans over here. Now the green scan is the design on step 30. The blue scan is the actual scan on step 30, the one that the doctor took. And the gray one is the initial position. So let's check first the before and after. The first scan is the gray, and the blue one is the actual scan from the doctor. You can see the attachments placed here. So we have achieved expansion, significant expansion. We don't have much movement in the anterior segment, but the expansion was achieved very good. And if you check, obviously we have some delays. Sorry, we cannot see the delays here, but what I want to show you is that we have pure expansion. And check the design. What did we plan? We plan expansion. We have step 30. We are going at this moment. Step 30 should be around here. Sorry, one less. Step 30. How did we plan this expansion? With buccal rotor. You can see the root. I think I'm not able to remove the gum over here, but you can see the root going buccally. This is done to maintain the torque and the torque was maintained very, very nice. We have some impactation of the palatal cusp, but we achieve easily 2 millimeters of expansion. Now let's check the comparison with the actual design on step 30, meaning we should have this position right now. And what delays do we have? Of course, you will never achieve 100% of the expansion. We have some impactation of the palatal cusp, but not much, because we try to control it. And like I say always in my video, you will never achieve pure expansion, but you may get closer to achieve pure expansion. This is why you cannot expand 4 or 5 millimeters, because the impactation of the palatal cusp will be way too much. Okay, so the other thing that I want you to see is that we have a very, very good results with the anterior segment. We are tracking very, very nice. The movements are doing very, very good. I think these are very good results. But the most impacting, the most shocking thing is the lower arch. We're having very nice results. And what is the advice for this case? Always use mini screws to distalize the lower posterior segment. And I will even change, now that I'm distalizing to the canine, probably you can place, I don't know if we can use this same mini screw to distalize the canine, but you can switch maybe an intra-articular mini screw here to distalize the canine. That way we don't have this situation. You can see that we are having some sort of lack of tracking over here. The distalization should be the green one. This is the actual scan on step 30. So we're having some lack of tracking. It's also important to show what things we can improve in our treatment planning. So always use TADS to distalize the lower posterior segment. It's the most advised. We have a dense bone in the jaw, so always distalize with mini screws, or if you're able to use a bend slider or any other appliance, it will be even better, because you can make the distalization even faster. So if you like this video, please subscribe to my YouTube channel. You can learn more protocols of staging and planning and staging protocols in my trainings. We offer online training, or we offer inside training in Barcelona. So thank you guys. I hope you have a wonderful day, and I hope you enjoy my videos. Take care.